dental office can really come into play too, that they can work with you on preventive strategies with different types of fluorides, different treatments that they can do to help just keep everything as stable as possible. And unfortunately, if somebody enters into treatment that already has active cavities, active infection inside of their mouth, it can really start a lot of problems for them that may cause their treatments to be delayed in some way, or maybe they have to stop because of infection or because of the pain issues. Your dental hygienist also can give you recommendations on products to help relieve dry mouth symptoms. And believe it or not all of the products that are out in the market are actually good for your teeth. Some of them can actually lead to more damage to your teeth. So it's important that you're getting recommendations from a trusted healthcare provider, just that they can investigate these products a bit and not just taking advertisements as your main source of information. Also avoiding certain detergents in products, especially toothpaste. There's some sudsing agents or detergents that help to have a really nice consistency for toothpaste or different oral health products that can be really irritating to the tissues. So sticking with products that are very gentle, free of all these detergents, free of other ingredients like whitening agents, tartar control, different peroxides, things like that can just be too harsh for tender tissue as you're going through treatments. So it's great to have a game plan as you go in. Make sure that you're not going in with any active decay, any active infections inside of your mouth that could cause complications, and start with making those changes before the side effects have a chance to begin, and then create a great relationship with your dental practice that you can be seen on a frequent basis after your treatments are done. The reality is, while you're in the treatment process, you will probably be told that you are unable to see your dental providers. So once you are done with treatments and you have that clearance from your oncology team, that is the great time to start a frequent preventive recall and make sure that you're not having any problems that can start to snowball. They can do all sorts of preventive measures, get you in frequently, that if a cavity would start or a problem, they can catch it early, because once it gets too far into the tooth structure, then they're more difficult to treat, it's more expensive to treat, and our treatment options become limited. For people who have had radiation to the head and neck, there's also a risk, depending on how much radiation you've had, for a condition called osteonecrosis, which can damage the jawbone. And that can make having any type of invasive treatment, like an extraction, or anything that could damage the bone in any way, the jawbone, can lead to this condition called osteonecrosis. So we need to make sure that your dental provider is treating you safely, and that they are taking measures so that you do not have to deal with osteonecrosis of the jaw, because once that starts, it can be very difficult to get that under control. And for some people, that can be a lifelong risk for them. Another thing your dental provider can check for is a condition called trismus. For people who have had head and neck radiation, they can have issues of times where it can become hard to open and close the mouth. The muscles that control the opening and closing of the jaw become tight and kind of limited in their movement. So your dental provider can actually take measurements when you are done with treatments or before treatments that they can compare and make sure that if they're starting to see that limitations in your opening, your closing, your side-to-side movements of your jaw, making sure that you're getting sent to the right healthcare providers to help to get that under control. And that could be massage therapists, it could be speech and language therapists, anybody that can help you keep that ability to keep that jaw mobile, for comfort, for oral hygiene capabilities, for eating, and just general function.